سيداتي سادتي، نرحب الآن برئيس المجموعة لأعمال الصيدلة بشركة فايزر، السيد جون يونغ.
Ladies and gentlemen, Pfizer Group President of Global Established Pharma Business, Mr. John Young.
So good afternoon, ladies and gentlemen. I'm really delighted to be here with you today. I'd like to begin by thanking King Salman bin Abdulaziz Al Saud, His Excellency Abdul Latif Al Othman, Governor and Chairman of the Board of the Saudi Arabian General Investment Authority, and His Royal Highness Prince Saud Al Faisal, Deputy Governor of the Saudi Arabian General Investment Authority. The pharmaceutical industry is honoured to have the opportunity to work with the Kingdom of Saudi Arabia and to partner with SAGIA, the Ministry of Health and the Saudi FDA, and to build on dialogue that began with His Majesty King Salman's visit to the United States in September last year. During King Salman's visit, he announced a major goal to reform foreign ownership rules in the Kingdom, to allow 100% foreign ownership of companies operating in the Kingdom. We applaud this important measure, and we offer our support and our partnership in finalising this policy and in building real momentum to create a modern, globally competitive marketplace for the healthcare sector. Our industry believes that there are many opportunities to support the government's prioritisation of the biopharmaceutical industry as a real area for investment and a real opportunity for the country. A vibrant pharmaceutical industry in Saudi Arabia will contribute to the strength of the economy and, most importantly, to the health of Saudi patients. Today I'll talk briefly about the role the industry can play in the growth of the economy while also addressing the country's healthcare needs. Specifically, I'll touch on the importance of Saudi Arabia to Pfizer, the role of medicines in healthcare, and outline policies that could lead to improved health outcomes for patients and economic advances for the country as a whole. Pfizer is proud to have had a long history in the Kingdom of Saudi Arabia, dating back to the early 1960s. Today we have approximately 400 employees in the Kingdom, supported by an additional 2,000 contractors, supporting the marketing and distribution of new medicines, as well as the development of health initiatives that are supported by our corporate responsibility programs. For example, in the last few years, we implemented a smoking cessation program to raise awareness about the health risks of smoking among the 35% of males, 6% of females, and 14% of students that smoke in the Kingdom. This effort built on the Saudi Ministry of Health's tobacco control program and resulted in 2 pilot mobile clinics operating in a number of shopping malls across the country. As of last year, there were 10 smoking education clinics that helped approximately 190,000 people attempt to quit smoking. We're also committed to ongoing investment in the Kingdom. In 2011, we signed a memorandum of understanding with the Saudi Arabian General Investment Authority to build our first manufacturing plant in the Gulf region based in King Abdullah Economic City. We were particularly honoured that Prince Saud joined the signing ceremony. Construction should be completed this year, and we anticipate that full-scale manufacturing will begin in 2017. The Saudi government is to be congratulated for their investment in healthcare infrastructure right across the country. The commitment to building new world-class hospitals and healthcare institutions, special centres and facilities for heart disease, heart surgery, and for the treatment of cancer recognises the growing burden of non-communicable diseases, such as diabetes, gastrointestinal disorders, ophthalmology conditions, cardiovascular diseases, and respiratory ailments. These illnesses today account for something in the order of 70% of all deaths in the Kingdom. And given the demographic changes and the projected increase in the number of Saudis over the age of 65 by 2030, maintaining current healthcare services and coverage will require both higher, but importantly refocused, healthcare investment in the future. This will be particularly important in the area of primary care, where investments in clinics, physicians, and medicines will foster better chronic disease management and prevention, and will create an optimally cost-effective and sustainable healthcare infrastructure. For example, almost 30% of the Saudi population today is affected by diabetes, and according to the World Health Organization, that number is expected to exceed 2.5 million citizens by 2030. In addition, around 5,000 Saudis are diagnosed with cancer each year, usually when the cancer is in an advanced stage. The most common type is breast cancer, representing around 20% of all cancer patients in the country. Providing access to a healthcare system which can provide accurate and early diagnosis, as well as sustainable access to modern, high-quality treatments, will be a critical and important role for a vibrant, innovative biopharmaceutical industry which can play a pivotal role. As a company, our purpose is to provide life-saving medicines and cures to patients that significantly improve their lives. Today, there are more than 7,000 medicines in development globally across the industry, targeting a wide range of diseases. Every day, the biopharmaceutical industry is exploring new approaches to attack diseases in novel ways. With advances in scientific tools, an increased understanding of the molecular and genetic basis for disease, the potential for new treatments and cures has never been greater. For example, since 1991, cancer death rates in the United States have fallen by 20%. In large part due to advances in medical treatments. Medicines are amongst the most efficient and effective use of private and public healthcare dollars. They offer the lowest cost, highest value interventions with significant benefits to patients' quality of life and longevity. Around the world, evidence shows the importance of a healthy lifestyle in preventing chronic disease. However, evidence also shows that complications from chronic diseases such as diabetes or high blood pressure can be prevented by adhering to an appropriate drug regimen, and that hospital admissions and the use of more expensive medical services can be reduced or avoided altogether. The effective use of medicines can support a more sustainable and efficient healthcare system, and when coupled with other reforms, can also be an enabler of real economic growth. But a strong, innovative pharmaceutical sector also requires an operating environment with the right regulatory policies, intellectual property protections, and an approach to incenting and rewarding the value of innovation and the quality of manufacturing through the pricing system. For the next few minutes, I'll touch on ways that regulatory practices, industrial policy issues, and intellectual property protection can not only improve patients' access to innovative treatments that will help them to live healthier lives, but to lead to a healthier workforce, resulting in productivity gains and economic growth through sustained and improved workforce participation. Firstly, when it comes to regulatory reform, I'd like to begin by acknowledging the significant improvements in the regulatory environment for drug approvals in Saudi Arabia. Timelines for review have decreased from 24 months from the date of submission, which has resulted in much faster access to needed medicines for patients. These efforts are to be commended. However, even more medicines could reach patients even sooner if the Saudi FDA were to adopt a target, for example, of approving medicines within 6 months of their approval in either the United States or the European Union. And with the leading role that the Kingdom of Saudi Arabia plays right across the Gulf region, we believe that you can continue to be a driver of real positive change. For example, facilitating a central approval system of applications through the Gulf Cooperation Council, and institutionalizing fast-track registration for breakthrough products. With regard to clinical research, the top 500 biopharmaceutical companies worldwide spent more than $66 billion on clinical research last year, And Saudi Arabia, we believe, could position itself to have a much higher share of that investment. As an industry, we are currently conducting something in order of 300,000 clinical studies every single year. Because of its clinical trial policies, Saudi Arabia only attracted 400 of these trials as of January 2016, compared to, for example, 8,500 clinical trials in the Middle East region and over 2,000 clinical studies in Turkey alone. In 2013, which is the last year for which we have data, Saudi Arabia attracted $4.3 million of investment from Pharma, which is the industry global association, member companies. This represented less than 0.06% of worldwide investment. Turkey, by comparison, attracted $27.3 million in investment income from Pharma member companies, with one source estimating that investment of over $100 million. So I guess the point we're making is that if the Kingdom really saw this as an opportunity, which I believe it really is, through harmonizing its clinical trial regulations with international standards and accelerated approval times, potentially we could generate more than $200 million annually of incremental investment, and just as importantly, develop really cutting-edge clinical experience in the healthcare system. Pfizer, like the rest of the industry, has to date conducted relatively few clinical trials in the Kingdom, but we really see that there is enormous untapped potential for expanding the amount of clinical research that we could conduct here on behalf of patients right across the Gulf region. Increasing the number of clinical trials will not only bring new revenue streams, but would also help speed the delivery of innovative new treatment options for patients in the Kingdom. All of these efforts together would give patients and healthcare professionals access to more treatment options more quickly, improving quality of life and productivity for patients, while also reducing hospitalization and national healthcare expenditures. Now let me say a few words about the importance of broader industrial policies that create a level playing field for multinational companies operating in Saudi Arabia. These policies not only help support high-wage jobs, they also generate exports that contribute to economic growth and sustainability. Today, the majority of biopharmaceutical research and development is concentrated in high-income countries, with policies in place to support innovation. That said, there's a growing trend by multinational companies like Pfizer to conduct R&D in local markets where we do business. So in addition to having a favorable regulatory, pricing, and IP environment, biopharmaceutical innovation also requires significant collaboration with all key stakeholders right across the healthcare sector and a commercially viable marketplace. It requires market-based measures that incentivize investment, facilitate rapid technology transfer, and create strong alliances and collaborations between government, healthcare institutions, and industry. Alliances that can not only strengthen local R&D, but also create a vibrant, flourishing biopharmaceutical cluster. Up to now, localization efforts in the Kingdom have been focused on the promotion of local manufacturing, and we believe that this is an important first step. However, enhancing the ability of the biopharmaceutical sector to conduct R&D in the Kingdom will help to bring breakthrough therapies to the Saudi market at a faster rate and will help to bring a new stream of revenue to the country. Similarly, the investment climate would be more attractive if we could have a highly skilled workforce which we could employ ourselves, that was able to develop, apply, utilize, and integrate new technologies, and importantly, to tap into Pfizer's global organization, rather than relying on gaining access to talent only through distributors. And finally, implementing regulations that allow foreign companies to pursue trading licenses under their existing structure will help ensure the integrity of the supply chain and continuity in the supply of medicines. We are committed to improving the health of patients in Saudi Arabia and are proud of the strong relationship that we have with the Saudi government. Improving the priorities on workforce and policies on workforce and trading licenses, as I just described, would strengthen that commitment and relationship, and I believe would really help to create a business climate that will attract significant foreign direct investment in the healthcare sector. Turning now to the importance of having strong intellectual property protections. As an industry, we have a positive relationship in countries with strong intellectual property policies and investment in local research and development, which leads to job growth and economic expansion. One of SAGIA's goals is to attract investment, and an important way to further the same would be to grant a period of market and data exclusivity for all pharmaceutical and biological products, similar to that which exists in the United States and Europe. Aligning with US and EU intellectual property standards would send a clear signal that Saudi Arabia is a pro-innovation economy and is creating the right environment to attract investment in innovation right across the kingdom. So in closing, the Kingdom of Saudi Arabia is an important, if not the critical, economic power right across the whole of the Gulf region, and we believe a country of enormous potential. Its resources, people, and capabilities are deep and abundant. Its goals of further investment in the country's people and infrastructure are well aligned with the goals of the global pharmaceutical industry. And Saudi Arabia has made significant advances in creating a regulatory process that streamlines our ability to bring new medicines to market. However, to create a truly sustainable climate for investment that will enable both a sustainable world-class healthcare system and a vibrant biopharmaceutical industry sector, the Kingdom needs to continue on the path of reform to address intellectual property issues and the regulatory environment, as well as implementing the reforms to localization policies and employment to level the playing field for multinational companies operating in Saudi, thereby facilitating increased investment in the Kingdom. These measures will continue to accelerate access to new treatments for patients, job growth, and contribute to the growth of the knowledge-based economy in the Kingdom, which we've heard loud and clear this week is a fundamental pillar of the vision of the government of Saudi Arabia. So I'd like to finalize by saying thank you for the opportunity to be here today. It's been a privilege to be with you this week, and we look forward to contributing everything that we can of our capabilities, our technologies, and our talents, and partnering with you in this exciting journey. Thank you very much.